So the mission of the AHEC program is to recruit, train, and retain health professionals, particularly in rural and under-resourced regions. And so the idea of AHEC is to create partnerships between academic medical centers, other health providers, and the regional AHECs. So in this case, we've had a long-standing relationship between the Duke School of Medicine, which is a pretty big place, and the Duke School of Nursing and Southern Regional AHEC. What that means is that we can partner between the staff and the faculty here at Southern Regional, but both at the School of Nursing and the School of Medicine. And those are deep faculties. And so if there are educational programs we need to develop, we usually can find someone who's a pretty good expert in the field who can partner with folks here to try to develop good programs. As a result, we've been able to really achieve a high level of excellence in our continuing education programs for all health professionals, but also we've been able to partner on grants to develop innovative programs that have really had the benefit of using the expertise at both places to try to solve some of the most daunting problems in rural and under-resourced parts of the state.
Well, patients complain that they can't get help. They can't see a doctor when they need to. AHEC did it by partnering with Duke to bring them down there. And we're not just a Duke partnership with undergraduate work. We help teach some nursing students.
So why did we need a new building? In 2001, when I came to SRAHEC, the building was already too small to meet the needs, but we had other priorities that we had to work on before we were able to take on the huge project of building a new building. But by 2012, it became impossible to continue to work in the building because of the infrastructure problems. There were continual problems with plumbing and flooding and electrical. And so we then made it a priority to look at other opportunities. We looked at some opportunities for exploring some partnerships with others and maybe buying another building or another space. But it became pretty apparent that the best thing to do was stay right there where we were. And due to the help of the NCAHEC program office and the Duke program office, we were able to get enough financial viability in place to qualify for some bonds to allow us to build the new building. So happy 50th anniversary SRAHEC.
In 2019, COVID challenged us in the way we took care of our patients, educated our learners, and took care of the healthcare needs of our community. We quickly transitioned to telehealth to allow our patients to have full access to healthcare while keeping their safety as our top priority. Our employees and our staff and our faculty were resilient during these difficult times. Since then, we have been very flexible but purposeful in how we take care of our patients, educate our learners, and meet the healthcare needs of our community. As a regional force in healthcare, we have achieved more than we could have ever dreamed of. None of this would have been possible without the support of our community, without the support of our Board of Trustees, our employees, our faculty, our residents. The unwavering commitment to healthcare and well-being of others was the shining beacon of hope during these difficult times.